Hello everybody. Today we will gonna discuss about the most expected NEET questions in 2024. So today we will discuss the PYQs that have been repeatedly asked in NEET in last 2-3 years. So we will start with ophthalmology today. So the rosette cataract due to blunt trauma have been asked 3 times in last 4 years. Uh, and the question was almost same every year. Similarly, fungal corneal ulcer, corneal ulcer have been asked 2 times in last 3 years. Visual field defects due to optic chiasma, optic lobe, optic tract, uh, optic chiasma, and optic nerve have been asked 4 times in last 4 years. Uh, the question is like that is asking the visual field defect and asking for the where is the lesion. It's the format they have been asking repeatedly. The optic manifestation of neurosyphilis has been asked 2 times in last 3-4 years, and the answer is the accommodation present and light reflex is absent in neurosyphilis. That is the optic manifestation. Pterygium has been asked 2 times, especially they have been interested in asking in treatment and the perfect surgery they might ask this year. Viral vernal keratoconjunctivitis that has been asked 2 times. Trachoma, especially safe strategy employed by WHO. When to employ the safe strategy in the population level? What is the level of vitamin A deficiency and what is the level of corneal cirrhosis or corneal ulcer that has been asked. The same blowout fracture, the teardrop sign is been asked 3 times in last 2-3 years. Teardrop sign on X-ray and also on CP that has been asked 3 times in last 2-3 years. And retinoblastoma. In retinoblastoma, they have asked different type question, but the most frequently asked question is the histopathology. And in histopathology, there is a Flexner Winstner true rosette has been asked. Flexner in true rosette. In true rosette, there is no gap inside the central. That is true rosette. And the central retinal artery occlusion and the sign is cherry red spot and diabetic retinopathy have been asked 3-4 times in last 4 years. Now we will come to the ear part. In ear, they have been asking multiple times malignant otitis externa. And the image based question, battle sign. Battle sign is seen in middle cranial fossa fracture. There is a bluish thin hue behind the ear on mastoid region. That is battle sign. And the order of auditory pathway, the mnemonic E. colima, has been asked to arrange the following in from to the ear to the visual cortex, auditory cortex, or from auditory cortex to the cochlea. Either way, they have been asking the E. colima stands for eighth nerve, follicular cochlea, and so on. I am forgetting it. And then they are asking an acute mastocytitis 3-4 times in last 5 years, and lateral sinus thrombosis have been asked twice in last 5 years. Glomus tumor twice in last 5 years. So now we come to the nose. In COVID times, they want to ask mucormycosis, but they might not gonna ask this year. But nasopharyngeal carcinoma, earliest symptom and most common symptom they have been asking last 5 years Two times they have been asked the most common and most earliest symptoms, the painless cervical lymphadenopathy, that have been asked three times in last 5 years. Center squared, that have been asked two times in last 5 years. Aspirin allergy, asthma, and nasal polyp is the center triads. The question language is that a patient is taking aspirin and develops nasal polyps and has known case of asthma. What is this? Or like what other feature will be there? They have been asking like that. Frontal mucosal, they have been asked CT scan of frontal mucosal last 5 years. Two times they gave the CT scan and gave the history of trauma some 10 to 15 years back, and then they asked the diagnosis. Rhinosporidosis, rhinophyma, rhinosclerma, all three they have been asking alternate year. Either of three they have asked about them. Atrophic rhinitis has been asked three times. X-ray views, they have asked alternate year, one of X-ray view. So, more commonly asked about water views, and some one year time they have asked Caldwell view also. Little's or Kisselbeck's plexus, the Little's area, the most common area of epistaxis, anterior epistaxis. There was juvenile nasopharyngeal angiofibroma, septal perforation, frontal sinusitis, office headache. They give a history of a corporate worker and they have a headache in more in morning times and it may be relieved in evening. Now come to the throat. In throat, they have asked Quincy three times in last 5 years. Very fond of to ask the Quincy, and Quincy is the parapharyngeal abscess. They give symptoms and ask what is it, or one time they have even asked what is parapharyngeal abscess is known as Quincy. Glossopharyngeal referred after tonsillectomy that asked two times. They given a history of tonsillectomy and then ask the patient have otalgia, for which nerve is responsible for referred otalgia, that is glossopharyngeal nerve. Leukoplakia, they gave image and asked what is the diagnosis, what is the risk of malignancy. Trismus is due to medial pterygoid spasm in parapharyngeal abscess. They have been asked two times the same question, same language. Fossa of Rosenmuller, ranula. Ranula, they give generally a picture with history and they will ask it that what is the diagnosis or what is the treatment of choice. And they might ask this year that what is the treatment of choice in recurrent ranula. Croup and acute epiglottitis, they may give a picture and ask in X-ray steep sign or steeple sign, laryngomalacia, tracheostomy in total laryngectomy, high tracheostomy. This question been asked two times that in total laryngectomy, which type of tracheostomy is performed? The simply high tracheostomy is performed. Laryngeal carcinoma staging, the TNM staging of some cancers are important. Out of one, laryngeal cancer is the one that is TNM staging is important. Laryngoscele, they have asked two times. Adam's apple is due to thyroid cartilage. They have been asking this question frequently. This most simple question: why Adam apple? This is due to thyroid cartilage. And life-saving muscle of vocal cord, posterior cricoarytenoid, only abductor of the vocal cord. This question has been asked four times, either way around. Which is the only abductor of the vocal cord? Posterior cricoarytenoid is the only abductor of the vocal cord. This is all about ENT and ophthalmology. Now, rest of the 17 subject will be discussed later on sometime.